Hi everyone, this is Brittany with slpmaterialgirl.com here to talk about why does my toddler lick everything and anything. We're talking welcome mats, trash bins, cones, the bottom of their tennis shoe, anything that the little toddler can get their hands on, they lick. And I want to talk about why. Why toddlers sometimes explore the world around them using taste when licking, and also why they lick and taste non-food items when that can become a problem, and if licking, tasting non-food items is an indication of autism spectrum disorder or attention deficit hyperactivity disorder. So that's what we're going to talk about today. So let's start with why. Why do they lick anything and everything? First let's say, talk about how toddlers have a natural instinct to explore the world around them using their senses. So that's touch, sight, taste, and putting objects in their mouth is a way for them to gather information about the things they encounter. So some of the reasons, sensory exploration. Toddlers are still learning about different textures, shapes, and tastes, so by putting objects in their mouth, they can gather valuable sensory information about the world around them. Another big one's teething. Teething can be a challenge for babies and toddlers as their teeth start to emerge. Chewing on different objects can provide some relief. If you've ever been a parent, an aunt, an uncle, a grandparent, all that, that, those budding teeth hurt, and they're going to do whatever they can to relieve that, those help comfort those sore gums. This is a big one. Oral fixation. The oral stage is a normal part of child development, according to Sigmund Freud's psychoanalytic theory. By the way, not a huge fan of him, but during this stage, according to Freud, toddlers explore their world with their mouths as they develop their oral motor skills. Typically, this occurs between birth and 18 months of age, but that can vary. It can be, after 18 months, especially if their teeth are coming in really late, which can happen, and they're still teething. Oral fixation is most prominent during the oral stage, but it's meant, like I just said, it's worth mentioning that children may continue to exhibit oral behaviors beyond this stage with different situations, including teething. But it does provide, this oral fixation provides comfort or sensory stimulation. Also, curiosity. Toddlers are curious. Putting objects in their mouth allows them to explore and experiment with cause and effect. They learn about all the, different properties of objects, such as whether they are hard, soft, squishy, whether they are edible, whether they're non-food items. So they're just curious little bodies. And then the last one kind of goes back to that oral fixation, that sensory stimulation is self-soothing. So when they feel anxious, bored, overwhelmed, they may engage in oral exploration as well as to self-soothe. Sucking or chewing an object may provide them with a sense of comfort and security. Kind of how some toddlers will suck their thumb. Now, whether you agree with it or not, they are just self-soothing. And that sucking motion does, lend to that. I think it's just in our biology to do that. So while it's natural for toddlers to explore objects with their mouths, it's essential for caregivers to ensure a safe environment and offer appropriate objects for exploration. So next I want to talk about, when does oral fixation in toddlers become a problem? All four of these pictures are pretty alarming to me. The one in the upper left, I don't think I would have paused to take that picture. I'm afraid that child is going to swallow that and choke. Okay, so when does it become a problem? Choking hazards. If a toddler consistently puts small objects or inappropriate objects in their mouth, it can pose a significant choking risk. So caregivers should ensure the environment is free of small objects that could be easily swallowed or cause choking. I mean, that can include, bottle caps or water bottle caps, those small little green caps on the Dasani bottle. Like, I always have to search the house for those because that's just the perfect object. It's so small. You just have to be really careful. Unsanitary objects. Toddlers may attempt to put unsanitary objects in their mouth, such as items found on the floor or unclean areas. This can lead to the ingestion of harmful substances or germs, increasing risk of illness. Now, I wouldn't go too crazy on this. You can be the most vigilant, best parent in the whole world, and your child, when they're in the back seat, is going to one day take their shoe off and lick the bottom of it. And, after you just got done at the park, and who knows what they stepped in. Who knows what they just licked off the bottom of their shoe. You can't control it. And, you can do your best, obviously, but it's going to happen, and they're going to put unsanitary objects in their mouth. They're going to touch a toilet, and then they're going to touch their mouth. And you just, you want to mitigate, you control your controllables, stop this happening if it's within your power. But if it's not within your power, like I said, you're driving the car and the little one takes their shoe off and they start licking the gum on the bottom of their shoe. You do what you can, but just, give them, in my opinion, give them some vitamin C, some orange juice if they can drink that, and just go on with your day and hope that little immune system just got a new trial to test it. So, but, to each their own. This one's kind of interesting. Interference with social interaction. So excessive oral fixation may interfere with a toddler's ability to engage in social interaction. If a child constantly has an object in their mouth, it can hinder their communication skills and make it difficult for others to understand them. So, it's just a physical barrier for them to use their mouth and to social engage. Also, it can, not totally to this extent, but if they demonstrate oral fixation beyond the typical, oral stage, like we're saying kindergarten, first grade, and if they let's say have a thumb sucking problem, there's a stigma that goes along with that, and who knows, kids can be cruel to each other. It might just give people the wrong impression. People attribute the wrong things to anyone, not just a child, but anyone's intellect. They can contribute behaviors or even appearances and misjudge a person. So, as far as social interaction and social, perception goes, not completely favorable. But let's just keep going. I could get stuck. Stunted development. While exploring objects through the mouth is a normal part of toddlers' development, excessive or prolonged oral fixation may impede other areas of development, such as fine motor skills, language acquisition, and cognitive development. If a child consistently relies on oral exploration as their primary means of interacting with the world, it can limit their overall growth and learning experiences. So if the only way they explore their world is orally, like tasting the grass, they're not talking about how the grass is green or how it feels warm in the sun. They are completely dependent on exploring their world orally. It's obviously going to limit their, sensory input and their knowledge of everyday things and experiences. So also just harmful behaviors. In some cases, excessive oral fixation may manifest as harmful behaviors such as biting others, chewing on harmful substances, or self-injury. If a toddler's oral fixation escalates to the point where it causes harm to themselves or others, it's important to seek guidance from a healthcare professional or a pediatrician. So yeah, just talk to your child's doctor. That is always a great go-to. Okay, so this is interesting. I wanted to explore, does oral fixation indicate autism or ADHD? Not necessarily. So oral fixation is sometimes observed in children with autism or attention deficit hyperactivity disorder. But here's basically how it relates. So with autism, Some children with, I'm gonna interchangeably call autism ASD or autism. Just know that that's what I'm talking about. Autism spectrum disorder, autism. Some children with autism may exhibit repetitive behaviors or sensory-seeking behaviors, including oral fixation. They may engage in excessive mouthing, chewing on objects, or repetitive licking. These behaviors can serve as a way for them to self-regulate or seek sensory input. However, it's important to note that not all children with autism exhibit oral fixation, and it can vary from individual to individual. As far as ADHD goes, children with ADHD often experience difficulty with attention, impulse control, and sensory regulation. So some children with ADHD may engage in oral fixation behaviors such as a means of self-soothing or seeking stimulation. So chewing on objects, pen caps, or clothing. I've seen necklaces that may help them focus or reduce their restlessness. Now, oral fixation is not exclusive to these conditions. Many typically developing children also engage in oral fixation as part of their normal development or exploration. But if you suspect that your child's oral fixation behaviors are related to autism or ADHD, it's important to consult with a healthcare professional such as your pediatrician. And they can assess your child's overall development, provide a proper diagnosis if necessary, and recommend appropriate intervention or therapies to address the specific needs of your child. So I'm saying if it's become a problem, not just every time, you go into the kitchen, your child runs toward the welcome mat and licks the welcome mat. I'm saying they're putting sharp objects in their mouth. They're putting dangerous small objects in their mouth. When someone else is babysitting your child, you're worried about their oral fixation. Like if this is a problem to you, just talk to your healthcare provider and get their input and possibly develop a plan to address it. Okay, so I've been giving this presentation basically to parents, but also to, school SLPs. So I touched on autism and ADHD. Are you a school SLP? And if you are you looking for social skills and pragmatic language products to help, treat your students with ASD and ADHD? I provide those on my site, slpmaterialgirl.com. My social skill products, they address, interrupting, listening, emotional regulation, making connected comments, joining a conversation, getting to know you, conversation rating system, idioms, emotions, and social scenarios and more. So I have this for sale on Teacher Pay Teacher as well as slpmaterialgirl.com. Oh, and Etsy. I'm going to leave some links below if you want to check it out. I sell these as individuals, and then I do sell them as a packet for a great low price. But yeah, I hope everybody out there is doing great. I hope you check out my site, and I just hope that you know that you are a wonderful parent or guardian, and if your child's put something disgusting in their mouth, that's just, that's childhood. You do your best, and that's all you can do, and that you're doing great, and don't ever think you're not. All right. Thanks so much. Bye-bye.